Hey guys, my name is Tier and I did my population health project on the LGBTQ community. The reason why I selected this community is to give everyone an insight on how this community reacts to healthcare concerns, how there are barriers to their care and other services they don't receive because how they identify themselves. So it's a lot of discrimination and mistreatment because of what they identify as. So for this community, I'm basing it off in New York City. Did you know that New York City has the largest LGBTQ population? Yeah, I didn't know either. So, for give you a little insight on this community, if you didn't know, LGBTQ means lesbian, gay, bisexual, transgender, and queer or questioning. It includes all races, ethnic, and religious backgrounds and a range of socioeconomic statuses. For the subpopulation, it indicates that about 4.9% of adults identify as LGBTQ. And evidence also suggests that bisexual and transgender people have lower incomes, higher poverty than lesbian, gay, and cisgender heterosexual people. For determinants of health, we have the determinants of health. It talks about the health disparities. Did you know that the LGBTQ health disparities and inequalities had evolved before the LGBTQ identity categories existed as such to this present day? Research shows a lifetime exposure to discrimination, poor health outcomes, and interpersonal stressors. Older adults of this community are exposed to higher rates of violence, medical mistreatment, and social isolation than compared to their heterosexual and cis peers. So this picture, it shows their vulnerabilities. So if for social determinants of health, we got lack of gender recognition, lack of relationship recognition, lack of access to care, homelessness, discrimination, stress and coping, risky behaviors, poverty, and lack of data. So this community have a couple of health issues. The health issues that they face are risk of STDs, chronic minority stress over life course, behavioral risk, and substance abuse. LGBTQ people are at a higher risk for mental health conditions due to their social stigma and discrimination. Another barrier is that LGBTQ community have difficulty accessing health insurance, finding competent healthcare providers, and getting medical care. Did you also know they experience discrimination from healthcare providers? And also they will use drugs to cope with their stress. So a couple things over here to chart, it says a couple examples. It says fear of discussion, mental health concerns with obtaining parent and caregiver permission, fear of not being taken seriously, lack of affordability, fear of care not working, fear of being outed, fear of my identity being misunderstood, concerns with receiving virtual care at home, lack of transportation. My nice little barriers of reasons. On this slide, we have the levels of prevention. So the level of prevention refers to the stage that implements a disease or health condition. So in this case, for primary prevention, we could educate and have awareness campaigns and raise more awareness about the LGBTQ issues, gender, and identity. For secondary prevention, we can have screening programs for mental health concerns and STI prevention. For third prevention, we could specialize treatment programs and plans for LGBTQ individuals with mental health issues and substance abuse. So for this community, they have a couple of health issues, but the main issue in this community is a main concern for STDs. STDs is a sexual transmitted disease. So things such as AIDS, chlamydia, syphilis, and gonorrhea, HIV. You could receive any of these by having condomless sex. It's the most significant risk of factors of getting and transmitting. And also, it could be mainly that reason of how you could get these things. That's the main health issue in this community. For future strategies that we can do to help this community, we can have better patient outcomes will be achieved in the care of LGBTQ community if providers learn the terms, understand health risks, and maintain a wealth of knowledge in the care of patients. Remember to use gender neutral language. Consider the possibility of anxiety, depression, and evaluation for sexually transmitted infections. But it's most important to respect LGBTQ patients and remember for the challenges they face from society as substantial. So if we just understand, if they come to us and they say, okay, I identify as a she and their pronouns are they, them, we should talk as, okay, they need this, they want this, in that type of terms, so we won't make them feel upsetting. I feel upset, so we just, also another thing, yes, we need to learn pronouns. Everyone should be on the same page, so we won't feel like we're outing them, but also we want to make sure that we let them know that we're all people, we're all the same, and we're going to all receive the same health care. Thank you.